Hi, I'm Robin Raskin here at Digital Health Live Studio, and I'm here with Shia Ahmed, Dr. Ahmed, to us, who just finished wowing the audience with this thing, Google Cardboard Glass. But tell us what you did with this Google Cardboard Glass.
So Google Cardboard is a rather cheap device that allows technology to disseminate it. So I used a 360-degree camera in the operating theatre. We created a video, live streamed, which people on their smartphone could download an app, pop it into the Google Cardboard, then put it on, and they'd be immersed into our operating theatre, looking around and seeing what's going on and being taught, essentially.
So you let them watch a live surgery
I did.
That you performed?
That I did.
Now, why would you do that?
Why would you? Some would say it was a crazy thing to do. I think the background is this. I think that my vision about how we connect people, how we help train people on a bigger scale across the globe with internet, is about how we use augmented, virtual, mixed reality, and how we utilize that to improve teaching and training and ultimately clinical practice. So the reason for doing it were, I think, to demonstrate that this sort of low-cost technology could help many people around the world to help train and educate and also make healthcare more equitable.
Right, so I know you talked about training doctors who didn't have access to top-rate teachers and mentors. That's one thing. I know you also talked about patient involvement.
Yes.
And you actually had patients watching their surgery.
Yeah, this is interesting. It's one of the it was interesting because I always thought, okay, where's the boundary for live recording? How does the patient feel about being operated on, number one, which is emotive, but secondly about viewing the operation? And how do the family themselves think about this? So a lot of people are a bit uncomfortable with that, but I think the best thing to do is to challenge it, ask people, let's do it, let's see what the patients have to say. Ultimately, it's their body, it's their consent that you're after. So surprisingly, when I have done these operations before with Google Glass or indeed VR, the patients that I've operated on who've allowed me to broadcast the operation have also watched their own operation in VR. And they felt it's somehow, strangely, supported by the idea about that they were in good hands, things were going well. The fans themselves watching live surgery were saying normally, look, hey, for 4 or 5 hours we don't know what's going on and we get a bit scared or anxious. This time we saw what was going on, but we're much happier, which I found quite surprising. I wasn't expecting that at all.
I would think. So now you have this company called Medical Realities, and the company's job is to
promote healthcare using technology across the globe, using both augmented and virtual reality. So we're trying to create a new way of training and teaching. My thoughts are we're on an evolution of teaching and training, from using books to iPads to mobile phones, and now the next steps for me are going to be including AR and VR into that equation. And our company is developing both those ideas to make education in a different way.
So VR today is pretty rudimentary, shall we say? It's one way, you're doing it, nobody's getting any feedback. If they've made the wrong cut, you will never know about it. So how do you see that progressing? Undoubtedly
the technology will get better. It'll become more cheaper and easier to record these videos. But if you get away from the wow factor, when you put this on, or a Samsung Gear VR, an Oculus Rift, there's a certain amount of wow factor involved. And every time you put it on, there's a wow. Let's get beyond the wow factor. What's the educational value? And how do we make that much better? People want more than just visual clues. Of course, having virtual reality headset looking around the room allows you to see how the team is behaving. And being a surgeon is about being in a team. It's not being a singular person. We've got to get away from that notion and actually think about how you behave and cope with things going on around you. And that's immersive, that's helpful. So I think that, but going forward, people want to feel, they want to touch, they want to use their senses. And ultimately, the way VR is developing, people develop all those skills around you and those senses to make this much more immersive, so you're able to feel and touch your way around this virtual world. Dr. Ahmed, you have changed surgery. I remember playing Operation as a kid, and it was really different. Thank you so much for being with us. I'm Robin Raskin here with Digital Health Live Studio.